Tonight we're going to hear about supplements for brain inflammation by Dr. Gary Kaplan. And Dr. Kaplan is founder and medical director of Kaplan Center for Integrative Medicine. He's the author of Total Recovery, and he's been a pioneer and leader in integrative medicine. Dr. Kaplan is one of 19 physicians in the country who's board certified in family medicine and pain management. He is a clinical associate professor of family medicine at Georgetown University School of Medicine, and he serves on the advisory committee to Health and Human Services for chronic fatigue syndrome. He's also recently started a foundation with the goal of curing chronic pain and depression. So please welcome Dr. Gary Kaplan. Thank you.
Thank you, Dr. Good evening. Thank you all for coming out this evening. Who wants a better brain? Quick show of hands. Who doesn't want a better brain? So it turns out that in all the work we've been doing with chronic pain and chronic illness, we've also managed to figure out a few things of how to keep people healthy, how to prevent them from ending up in our shop. And there was a paper that just came out. I'm always looking to keep you up on the latest research. And this one I just started working on this weekend, but it's particularly interesting because it talks about a condition called Diminished brain resilience syndrome, which I had not seen in the literature before. And what it's talking about in particular, they're looking at traumatic brain injury. And they're seeing this significant rise in traumatic brain injuries occurring. And you would think, okay, well, it's because we're seeing more people participating in sports and we're seeing more sports injuries, but it doesn't correlate. In fact, the participation in organized sports has gone down a little bit, and yet the incidence of traumatic brain injuries is going up. And they're arguing in this paper that the reason for that is that our brains are becoming more susceptible to trauma and less resilient, less able to recover. And I would absolutely agree with that assumption, because I think that's also what we're seeing with regards to chronic pain and depression in people, is a loss of resilience in the central nervous system. So this all ties back into this whole business of neuroinflammation that's been the subject of my research and the work that I do in the center. And so what I want to do is walk you through that process of inflammation again, because it is so crucial to understand what inflammation is in the brain, because it's a different thing than it is inflammation in the other parts of the body. So just briefly to go over this again, inflammation is a lot of things, all right? So if you have allergies, you have a runny eyes, runny nose, okay? All the tissues are swollen, they are inflamed. But they're inflamed as a consequence of getting exposed to things you're allergic to and the release of histamine by mast cells in your body. The way you treat that kind of inflammation is with an antihistamine, or preferably eliminating things you're allergic to. If you get a cut and it gets swollen and pussy and painful, that's also inflammation. But you don't treat that with an antihistamine, it won't work. You treat that with an antibiotic, because the inflammation is being mediated by bacteria in the cut. So different areas of the body get inflamed for different reasons via different mechanisms. And even pathogens, such as bacterial pathogens that occur, cause inflammation in the brain differently than they cause inflammation in the rest of the body. So if we don't know the underlying mechanism, then we don't know what the targets are for our treatment. And that's why I've been so focused in terms of looking at this chronic inflammatory conditions in the central nervous system. Central sensitization syndrome is chronic pain and a neuropsychiatric condition combined. So people who come in with lots of pain, fibromyalgia type pain, chronic back pain, chronic headaches, and anxiety disorders, and depression, or post-traumatic stress syndrome. This combination is a particularly vexing problem, and it indicates ultimately a great deal of inflammation in the central nervous system. And it's usually a result of cumulative assaults on the nervous system, exactly what they're talking about here at diminished brain resilience syndrome. What we've learned is that inflammation in the brain is at this interface between the neuroimmune system. All right? And so what happens is you have death of neurons. All right? Half the brain is made up of neurons. The other half of the brain is made up of glial cells. And that actually turns out to be very important. But half the brain is made up of neurons, and that's where we always thought all the information was being transmitted and everything else. Anything that damages neurons causes release of all of these chemical messengers. And they go out, and then they activate the repair process. All right, there's been damage. The body now needs to repair. But the body also needs to make sure the damage gets limited and that the things causing the damage are eliminated. In the case of the central nervous system, what does this is the microglia, okay? And the microglia, when activated, go through a series of transformations that move them into an inflammatory state. And then they kick off all kinds of inflammatory compounds. And then those inflammatory compounds also kill off neurons. So you don't want them too activated because they do a lot more damage. You get a lot of collateral damage going on. So life in the nervous system is referred to as DAMPs and PAMPs, damage-associated molecular patterns and pathogen-associated molecular patterns. And so pathogens are obviously things like bacterial infections, viral infections, and then damage-associated are concussions, and we'll go over other things that are associated with that, toxins. But this is the cycle that starts the whole process, that starts the inflammation going on. Damage to a neuron, release of these chemical messengers, turn on the microglia. The microglia are what mediate inflammation in the central nervous system. So when they get turned on, they go through this process called microgliosis. So microglia are little tiny cells. They're immune cells in the central nervous system. What they do is they hang out and they monitor the environment. They're called a sessile state. You want to get fancy, they're an M1 state. And they sit there and they're just checking for any damaged neurons. They're looking for those chemical messengers. When they sense those chemical messengers, they undergo a transformation. And they move into what we refer to as an inflammatory phenotype. Okay? This is a non-inflammatory phenotype, the way they express. This is an inflammatory phenotype. And they can go all the way to a full macrophage. Macrophages engulf bacteria and viruses and kill them and eliminate them from the cell. This just sends spewing out all kinds of inflammatory particles. So we then turn around and say, okay, what are the things that potentially activate the microglia? And it turns out lots of things. So psychological trauma, long-term stress will cause inflammation in the central nervous system because it results in damage to the neurons. All right, ischemia. Well, what kind of things cause ischemia? Strokes, obviously, that's a loss of blood supply to the brain. But there's a number of people that we see who have a thing called POTS, postural orthostatic tachycardic syndrome. We see this occurring in people who have, you ever go to Cirque du Soleil and you watch people turn themselves inside out? That ain't normal. In fact, there's a medical name for it. It's called Ehlers-Danlos Syndrome. These are people who have damage in terms of encoding their cartilage, and it makes them really stretchy. All right? So they're able to turn themselves into pretzels and dislocate things and relocate things without lots of screaming that I would actually endure if I had to do those things. So, and there are things we can do to test for EDS on people, simple test. I had one young lady come in one day and you look at whether or not you can bend your thumb back and touch your wrist, whether you can lift your fingers straight up. And one of the other things is put your hands flat on the ground without bending your knees. And she could do everything but that. And I thought that was rather intriguing. And she said, oh, but I can do this. And she hops on the table and she proceeds to get on her stomach and wrap her ankles around her neck. It's a complete circle. I said, okay, that counts. So EDS, which is unbelievably underdiagnosed in people, is one of the things that can lead to postural orthostatic tachycardic syndrome because they have laxity in their blood vessels and they don't hold the blood supply up. All right, these are people who get lightheaded every time they stand up. Indeed, they can pass out every time they stand up. And so we have to look for these things, and I'm astonished how many people come into the office who have not been diagnosed with this and in fact have it. So in POTS, these people are standing up and they get lightheaded. Every time they get lightheaded, they are losing blood supply to their brain. Every time they lose blood supply to the brain, they damage neurons and inflammation occurs, right? So now we've got them in a chronic inflammatory state, and I'm seeing a bunch of kids with EDS and POTS who are chronically in pain, chronically depressed, chronically anxious. These are 16-year-olds, 14-year-olds. Yeah, exactly. And it's critical that we make these diagnoses on these people, because when we fix their blood pressure issues, a lot of the rest of this stuff goes away, because depression and pain are symptoms of inflammation in the central nervous system. Okay? So POTS is something. Autoimmune diseases, all right? Celiac disease, we've talked about extensively at these lectures, is one example of it, but lupus is another example of an autoimmune disease that can create these kind of problems. Medications, all right? The medications we use to treat pain can be the problem. So opioids, when used on a regular basis, initially reduce pain, but chronic use of them upregulates the microglia, moves them into an inflammatory phase. That inflammatory phase creates not only tolerance to the medication, but a thing called hyperalgesia. It makes you more painful. So it makes the pain worse when it's supposed to be fixing it. So opioids are an example of medications that can create the problem. Infections, Lyme disease, mono, chronic strep. We're seeing a lot of kids with pandas, this pediatric autoimmune issue, where one day, I had a kid that I'm working on, he woke up one morning and all of a sudden he had obsessive compulsive disorder. He is looking at himself in the mirror, he's exercising aggressively, he's developed an eating disorder, and they're treating him like he's got a psychiatric problem. And guess what? It ain't working. And they're trying to find an eating disorder clinic for him, which they are having trouble because he's a guy and guys don't develop eating disorders, girls do. So they're trying to find a program that makes a match for him, and they're going on and on and on. And nobody bothered to check and see whether or not he had pandas. In fact, he had Lyme, and that was the etiology of it. And we're seeing a number of people, not just kids, but also adults, who are developing these neuro-inflammatory conditions as a result of Lyme disease. Big problem. But you don't ask the question, you don't find it. We have to quit treating depression and other neuropsychiatric diseases and chronic pain as diseases. They are symptoms. They are symptoms of an underlying inflammation in the central nervous system. We need to find out what set off that inflammation. Physical trauma, the concussions that we're talking about in this one particular paper. And I see people who, 1 concussion, 2 concussions, 6 concussions. You think they'd have learned their lesson somewhere along the line. But eventually you hit a tipping point where the brain remains in a chronically inflamed state. So what happens is there's this thing about genetics that tells us how much resilience we have in our system. And then there's things, epigenetics, which is all this environmental stuff. All right? Stress, the foods we eat, the medications we take, the amount of sleep we get or don't get. Okay? The trauma, the physical traumas that we take, the medications that we take, these are all epigenetics. These are the things that turn on or off different genes in our body and ultimately determine and test the extent of our resilience. How can we recover? So, physical traumas, toxins. Okay, toxins are a really interesting topic because we've been focused for the longest time on things like heavy metals such as lead. Anybody born before the 80s was exposed to leaded gasoline, fumes in the air, but you were also exposed to lead by virtue of every time you moved and you sanded down the new nursery or the bedroom or whatever room you were doing. It all had leaded paint in it. You aerosolized that lead and you breathed it in. That puts lead toxins in your body. Mercury, we've been getting mercury thanks to our fish. But the new toxin that's really doing us in is Roundup. Okay? It looks like the problem with the GMOs isn't the GMO itself, although there are some problems with that. Okay, these genetically modified grains. And they've been a godsend in some cases. All right? I had the privilege of meeting and talking with Sir Richard Richards, who invented golden rice, all right? Vitamin-enriched rice. And he won the Nobel Prize for that a number of years ago. And we were talking about this, and he's a very strong proponent, obviously, of GMOs and what it can potentially do to improve the nutritional status of people in the world. But he did acknowledge that the one problem is, what's happened is these grains are resistant to Roundup, to the herbicides that we use. And so now what's happened is we're dumping tons of Roundup on the crops. Roundup is now getting into the food supply. Well, guess what Roundup does? It's a neurotoxin. And actually, it's not a neurotoxin. I'm wrong in making that statement. Roundup is not a neurotoxin for us, and they decided that since Roundup wasn't a poison to humans per se, but only to plants, it wasn't a problem. There turns out to be a place in our bodies where there's this huge amount of bacteria that are in fact sensitive to Roundup, our guts. Okay? There's 100 trillion cells sitting in our gut. 90% of the DNA in our body is in our gut. The gut and the brain communicate constantly back and forth. Inflammation in the gut equals inflammation in the brain. Dissolution of the gut-blood barrier represents dissolution of the blood-brain barrier. That blood-brain barrier is necessary to keep things out. It makes it an immunoprivileged organ. So it stops things that are circulating elsewhere in the body from entering the brain. If you've destroyed the gut-blood barrier, you've damaged the blood-brain barrier. So now we're seeing a mechanism via which Roundup is in fact damaging the gut flora that we have, the end result of which it's damaging our brains. So their argument is correct. It's not a direct neurotoxin, but it sure is toxic to us by virtue of the bacteria that we harbor, host, and need in our bodies in order to have health. So I strongly encourage everyone to eat non-GMO foods simply because the amount of Roundup on it will be dramatically less. There's an interesting correlation, a graph that I just saw looking at the incidence, the consumption of Roundup ending up in our food supply and the development of Alzheimer's. And they track in a very impressive manner, like 1-to-1. Now, coincidence doesn't mean that it's causation, all right? So it may not be the cause. But you got to look at it and go, why is the Alzheimer's going up exactly at the same rate of the amount of Roundup consumption we have? We have to do the research to find that out. But the point of the matter is, I think I'd err on the side of safety and do everything I can to get that out of your diet. This is all about building resilience into our brains by not poisoning ourselves anymore. So it's not just about supplements, it's about our diets. Okay? It's about our exercise habits, because exercise actually reduces inflammation in the central nervous system, as does meditation. So it's about building a lifestyle in to reduce inflammation in our brains and build resilience into our brains. All right? The microbiome and diet we talked about. We know that the gut microbiome, we just got RRIB approval to start a gut microbiome study with the Craig Ventnor Institute looking at people with central sensitization syndrome. What we're going to do is we're taking 20 people who have a neuropsychiatric illness and chronic pain and 10 people who are complete normal controls. We're going to analyze the entire gut microbiome in these individuals. And we're going to see whether or not there are any patterns developing in those who are ill versus those who aren't. So this is the beginnings of starting to understand the relationship between the gut and the brain in this particular condition. Musculoskeletal damage. Pain begets pain. So as you turn on the pain signals turn on other pain signals. So if you've got ongoing damage in the musculoskeletal system, herniated disc, arthritic problems, all right, all of these things help keep inflammation going in the central nervous system because they fire off the pain signals. So you get a reciprocal relationship between the brain becoming inflamed, creating more pain, and the periphery sending pain signals into the brain, creating more inflammation. So you've got to shut down things that are going in the musculoskeletal system. Hypoxia, number one cause of hypoxia. It's a loss of oxygen in the brain is sleep apnea. 5% of the population, only 15% of the people have been diagnosed with sleep apnea to date. If you're falling asleep during the day, if you're having trouble staying awake after eating a meal, if you fall asleep while reading, watching TV, if you're waking up unrefreshed, if you snore heavy, you need to consider whether or not sleep apnea is playing a role in your life. And so it's very important to be thinking of that as you're working this stuff up. And again, 5% of the population, that's a lot of people. All right, metabolic gets in terms of diabetes, and diabetes is very interesting. Paper I was also going through the other night. They're now talking about type 3 diabetes. What is type 3 diabetes? We have type 1 diabetes, which is insulin dependent, type 2 diabetes, which is not insulin dependent. Type 3 diabetes may be a problem in the use of glucose in the central nervous system. So you don't see diabetes in the rest of the person, but you do see it in their brain. So more to come on that. All right, so all of these things go on. All of these things turn on the microglia, create an inflammatory state, and then all of these different types of chemicals come out. All right? And the problem is it's not just one, it's a lot of different chemicals that come out. So it makes it a little tougher to target. But what happens as a result of all of these chemicals coming out is these things. Depression, anxiety, fatigue, sleep disturbances, endocrine disturbances, problems with thyroid, problems with cortisol management, pain, problems with the gut, because the brain talks to the gut, and the gut talks to the brain, and if one's dysfunctional, the other one will be dysfunctional. Fevers, POTS, all of these things go back and forth, okay? Chronic fatigue syndrome is a symptom of inflammation in the central nervous system. So chronic pain and depression are symptoms. I've said that a few times. Anybody not know that yet? Inflammation is, listen, I repeat this all over the country. Okay, it is slowly getting through. It is slowly starting to show up in other people's writings in the literature. But it's been a slog, I have to tell you. The psychiatrists are like way ahead of us. The chronic pain people are going, isn't it here that hurts?